Hi, I'm Patrick,
I'm Celso.
and we're going to discuss the back and body wall muscles. So the back muscles, which are also known as the extensors of the vertebral column, all help to keep us erect. Good posture. They all pull so that we keep up straight back. So from superficial to deep, there are 4 different groups. So first, the spinotransverse group, which means that it originates from the spinous process of the vertebral body and inserts onto a transverse process. And this one is splenius. So you have splenius is capitis and splenius is cervicis. So like if you wash puppies, that's his cervicis. So that's, yep, and that's the most superficial group is the spinotransverse. Then you have the erector spinae group, which each muscle lies side by side. And so I call these the spinae sisters because, hello, they sound like sassy sisters. So you have the iliocostalis. Her hair is so long, it helps with ipsilateral rotation of the vertebral column and extension of the vertebral column, just as all of they do help with extension.
Is that the most medial?
That is the most lateral one. That's the one on the furthest. That one's on the outside. And so ipsilateral rotation, if you don't know, is helping rotate to the same side. So if you're rotating your trunk, if you're turning this way, then the muscles on the same side are helping you turn that way.
Yeah, ipsi means same.
Yes.
Contra is opposing, so it's opposite.
Magic. And then you have longissimus, which her hair is so long, like Rapunzel status, longissimus. And it helps with the extension of the vertebral column as well as ipsilateral rotation of the neck, which because it expands so long. And then you have spinalis, which her hair just spirals up. Woo! And that's the extension of the vertebral column, and that is the most medial. So lateral is iliocostalis. Intermediate, which means in between, is longissimus. And then you have spinalis, which is the most medial, closest to the spine. The group deeper to that is the transversospinalis, which means it originates on the transverse process of the vertebral body and inserts onto the spinous process of vertebral body. And in that group, you have semispinalis, which she only spins halfway because that's all she's good for. Halfway spin, semispinalis.
She doesn't put in all the effort.
Yeah, she doesn't care. She's a let's get a C to pass school, and then that helps with extension of the vertebral column, just as they all do, and contralateral rotation of the vertebral column and head. So when I'm spinning this way, this side of my semispinalis is activating so that it helps me turn this way. And then multifidus. Just say it, multifidus. And that is that's the deepest along and most medial of the back and body wall along the vertebral column. It pretty much helps with extension because it's so close to the spine. It's the only thing it can do. And then after that group, in the deepest layer of the back muscles are the suboccipitals. You only need to know them as a group. And that's the extension and ipsilateral rotation of the neck. And that's pretty much the back wall. So you have the spinotransverse with splenius and his capitis, and splenius is cervicis, like he washes puppies. Then you have the erector spinae sisters with iliocostalis.
And that goes from the ilium to the costals.
Yes.
That's how you can tell
in
where
between
it is.
each rib. And then you have a longissimus with her long hair. She's the middle sister. Go figure. She needs attention. And then you have spinalis, which is the most medial, and her hair just goes straight up. And that's the way to remember it. And then you have the transversospinalis, which is semispinalis. She don't put all the work, and multifidus, and suboccipitals. And these all help extend the vertebral column. So if you had a question, what helps extend the vertebral column? You have all your choices. We're also going to talk about the body wall, and I know this one's a bit more tough, but the best way to look at this is divide it into different parts. So you have 3 regions of your body wall. You have the thoracic, your cervical, thoracic, and your abdominal. And so in each region, you have 3 sections. So you have the ventral, the lateral, and the subvertebral, which means it's just right before the vertebral column, which makes it part of the body wall.
In front of the,
Yeah, what he said. And so if you think about it that way, when you break it down, when you know that there's 3 regions and each region has 3 parts, then all you have to learn is the muscles. So For the cervical region, the ventral muscle is the hyoids, which help with speaking and swallowing. So yeah, just speak and swallow and hold right here. You know you're holding your hyoids. See, he doing it. He got it right. And then you have the lateral, which are the scalenes, which help with which are lateral flexion and assist with forced breathing because they do attach to the ribs. Any muscle that attaches to the ribs will help with forced breathing. And that's the scalenes. You have the anterior, middle, and posterior scalenes, and they all do the same thing. Then you have the subvertebral, which is longus colli, which helps with flexion and contralateral rotation of the neck. So if I'm turning this way, this side is activating so that I can turn my head this way. Contralateral. Magic. And that's in the cervical region. So, an overview of that is cervical region, ventral is hyoids, lateral is scalenes, and subvertebral is longus colli. Moving to the thoracic region. So the thoracic region is the second of 3 regions of the body and back and body wall. And the three sections, ventral, lateral, and subvertebral. So ventral, you have a sternalis right here in the sternum. Only 8% of the world's population has it.
So I don't have it.
Yeah, I don't have it. I mean, I'm not that special.
Kaipo does.
Kaipo does. He does.
Supposedly, I haven't seen it.
Yeah, and if you watch this and you don't know who Kaipo is, he is the teacher. Magic. And it helps with just flexion of the sternum based on evolution. That's why only 8% have it, because we no longer use it.
Yeah.
And in the lateral, there are 2 muscles in the lateral part of the thoracic cavity. You have the diaphragm, or the diaphragm is most commonly known, and that is the source of quiet breathing.
Yeah.
What it is, it's pretty much like an umbrella that separates the thoracic abdominal region. So if you think about like reaching underneath your rib cage,
Yeah.
you can probably feel your diaphragm.
This is an interesting muscle because what it does, it like scoops up and like opens up like that and then pushes it out. Like,
and that's the muscle that makes you breathe. And with that, just fun fact, only three structures actually go through the diaphragm. That's the aorta, which is your artery that goes straight to the heart. You have the inferior vena cava, which is the vein that goes back to the heart. And your esophagus, because your stomach's underneath your rib cage. Oh my gosh, crazy anatomy. And then you also have the intercostals, which keeps the space in between your ribs, as well as help breathing, just, the expansion and the contraction of you breathing. And for the subvertebral area of the thoracic is longus colli, because there is really no subvertebral one, but longus colli is long enough to go into the thoracic region from the cervical region.
It's
Longus colli. And so, quick overview, thoracic region, you have the ventral, which is the sternalis, and only 8% of people have it. You have the lateral, which is the diaphragm and the intercostals, and the subvertebral, which is longus colli. Finally, the abdomen, which every guy is concerned about when they go to the gym.
Yeah,
Gotta have that 6-pack. Gotta have that 6-pack. So let's talk about that 6-pack. In the ventral area is rectus abdominis, which is for flexion of the vertebral column and compression of the abdominal cavity. This is your 6-pack. If you don't got one, that's okay. No judging.
It's still there.
Yeah, it's just not as buff. And that's
You
fine.
just have protective barriers around it.
Yeah, and it's not under constant stress where it needs to be buff. And then with that, in the lateral section of the abdominal, you have 4 layers. Well, you have technically 3 layers and one's on the same plane. So the first layer is the external obliques, which are contralateral rotation of the trunk, weak flexion and compression of the trunk. So these ones are these the back pocket or front pocket?
These are the front pockets.
Okay, these are the front pocket ones. So it's like if I'm going to go into my front pockets, they go straight like this, and it's from the rib down. And then you have the internal obliques, which are your back pockets.
So they go like this.
Yeah, and they just, if you're trying to reach for that wall in that back pocket, that's where they go. And this helps with ipsilateral rotation, which is rotation to the same side, weak flexion and compression of the trunk. Okay, and then the third layer, which is transversus abdominis, helps with compression of the abdominal cavity. This is your core. This is your life. You gotta work this out. Do some planks, sit on a yoga ball. This is an important muscle because this is what stabilizes everything. All it does is compress the abdominal cavity, but it's so important for everything else. And then on the same level, but actually behind the vertebral column, this is the only muscle of the back and body wall that goes behind the vertebral column, is quadratus lumborum, which is a very angry muscle on most people. And it helps with lateral flexion, extension of the lumbar vertebrae. and yeah, and it helps with force breathing because it is attached to the floating ribs. But this is usually tight on people. A lot of people like overwork it, and
They complain.
They complain, and so
Back problems.
you'll probably complain when you get to injury or trigger point. You gotta work this muscle.
Trigger.
You will cry, or you're just like, I don't care because my quadratus lumborum is not in pain. Anyway, that's the lateral, and then subvertebral. This is a really interesting muscle that's part of the body wall, but it's also part of. It's the only muscle that goes down into the lower limbs, and so it's called psoas major. He's so cool. So psoas major helps with flexion and weak lateral rotation of the hip, and helps deepen the lumbar curve. So it starts on the transverse processes of your lumbar, go down, crosses the hip, and to the lesser trochanter of the femur, and that is part of your body wall.
And that's psoas major.
Yeah, he's so cool. Like.
Or when your mom used to spank you, you get a major psoas.
You do. Like, oh man, ooh, those days. Anyway, quick overview. You know, the abdominal region, which is ventral, which you have rectus abdominis, six pack, buff. And then you have lateral, which is the external obliques, the internal
Front
obliques,
pocket.
back pocket, transversus abdominis, and then the QL, or quadratus lumborum. And then for subvertebral, you have psoas major. He's so cool. And that's pretty much a way you can remember the back and body wall. Take it in parts, take it in bits. Like once you know that there's cervical, thoracic, and then abdominal, then go into ventral, lateral, subvertebral. Stop right there. If you don't know that, keep on telling yourself to do it by the names, and then you can start on the muscles and what they do.
3 sections, then 3 subsections.
Yep, and then muscles, and that'll help you. That's the easiest way to learn it. For the back, just remember that in the order that we did it from splenius capitis all the way to suboccipitals, it is superficial to deep. So if it's ever like, what's superficial to longissimus? You know it has to be a splenius capitis or splenius cervicis. Because, hello, it's superficial to deep. And yeah, if this helps, just let me know. Just definitely if you have any questions or clarity or anything, you can always ask room 2, because we're not going to be in room 2 forever, and you may be watching this in maybe years down the road. And that's it. So, hi, I'm Patrick, DM0514. That's all. So,
It's also.
hopefully that helped, and have a good day.
Thank you.